good, then I'm going to smooth this over. Oops. And so, okay, then we can begin. Hello and welcome everyone to our last session of the Intereconomics CEPS conference, focusing on COVID-19 from lockdown to recovery. Our final session is called Post-COVID, a Return to Normal, ? My name is Jiffer Bourguignon, and I am an editor with Intereconomics here in Hamburg. And I have the pleasure this afternoon of moderating this session with two distinguished individuals, Gros Eichengreen, Professor of Economics at the University of California, Berkeley, and Daniel Gros, who is the director of CEPS. Barry, we're very happy that you could join us today. We weren't sure if you were going to make it given the wildfires and the strong winds in the Berkeley area. So I'm glad to see you. So let's start with a little overview. Currently, the number of corona infections worldwide is just under 44 million, with over 1 million deaths worldwide. Cases are currently rising in Europe, and the US has just averaged at least 71,000 new coronavirus cases a day for the past 7 days, which is a new record, the highest number since the pandemic began. The second wave is upon us, according to most experts. There is a little consensus among politicians, but not completely, about how to best contain the spread of the virus while avoiding a full lockdown of the sort that happened earlier this year. Today, we're going to consider the pandemic's impact and the shape of the global recovery. I would like to look at the countries who have fared the best, considering factors including healthcare management, political response, and the financial policy response, and who has failed to curb the spread of the virus. We'll also discuss the expanded roles of government and the particular challenges faced by developing nations. I'm going to give each of you a few minutes to make an opening statement, and then we'll take it from there with a few questions from me as well as from our viewers. Please feel free to submit your questions via the Q&A button on the bottom of the screen if you are viewing via Zoom. If you are on the YouTube channel, you will not be able to submit questions that way, but you can submit questions via our Twitter feed if you tweet them with the hashtag IECEPS20. That's IECEPS 20. Great. Okay, Barry, we would love it if you would say a few words to start us off.
Sure. So thank you for the invitation and opportunity. That is an ambitious agenda. And I would note also that there is a bit of a tension between the title of the session, Back to Normal After COVID, and Jiffer's comments about second wave and 71,000 cases a day in the United States. I would make a couple of points about that. First, I think the evidence now is indisputable that containing the coronavirus and economic recovery, economic stabilization and recovery go together. I would cite, for example, a new NBER working paper by Chad Jones at Stanford that came out a day ago that documents that fact that countries which have done poorly in terms of virus containment have done poorly economically. And conversely, there are a few cases where the two don't go together.
I'm afraid Barry has just frozen for a second. Let's see if we can get him back.
For example, California. Several emerging markets outside Latin America have done. Asia, has been widely cited, but African countries as well. And I think it's useful to ponder the African exception. Many people thought that the pandemic would be absolutely catastrophic for African countries, and it hasn't been as catastrophic as thought. Why Africa? One answer would be relatively young populations, and I think that's part of it. Another part of the answer might be past experience with epidemics. My own work suggests that past experience with epidemics cuts two ways. On the one hand, you have more competent and experienced public health services that are familiar with what needs to be done in an epidemic. On the other hand, my work suggests that epidemic exposure in the past erodes the public's trust in government, especially younger members of the public. So that past experience, as I said, cuts both ways. The other point I would make about why some countries have done better than others in containing the virus has to do with individualism versus communitarianism on the one hand, and political polarization on the other hand. There's this famous book, Riding the Waves of Culture, from 10 plus years ago by a couple of management consultants that emphasizes the contrast between individualism versus communitarianism. So this tells us that something useful can come out of management consulting. But more generally, I think the point they made about different corporate cultures applies to culture more generally. In the United States, we have the frontier spirit. We have rugged individualism as part of our history and culture, which makes it hard to pull together as opposed to pulling individually, which translates into, I think, a fundamental mistrust of government, which is a problem for trying to fight the virus. And the contrast with Asian countries, which are more communitarian oriented, I think is quite striking. Here too, there are exceptions. New Zealand is a country of individualists, famously, so it doesn't quite fit into this paradigm. But by and large, I think the contrast between cultures and countries with individualist orientations and values on the one hand, and communitarian cultures and orientations on the other, and how they've done in terms of fighting the virus is quite striking. The other dimension of this is political polarization, that more polarized societies and countries, I think, have had a harder time fighting the virus. Political polarization breeds distrust in government among half the electorate. Wearing masks becomes a partisan issue in polarized societies like the United States, where political polarization has been increasing for the better part of 4 decades because of gerrymandering, the way congressional districts are drawn, encouraging politicians to play to the base and adopt more extreme positions because of the echo chamber effect we have in the media. I haven't yet seen much in the way of systematic analysis of how individualism versus communitarianism and polarization versus consensus have affected how societies have dealt with the virus. But I think those are issues that would repay further thinking.
Okay. That's very interesting points. And we will definitely, a little bit later on in the discussion, there will be a few questions coming up, especially with regard to the election coming up exactly 1 week from today. So but we'll get to that a little bit later on. Thank you, Barry. Daniel, would you like to say a few opening words?
Yes, I was listening with great interest to what Barry was saying. And I was thinking, how can I square that with the raw data I see developing on both sides of the Atlantic. So far, Europe has been better at, Europe meaning EU 27 in average, has been better at containing the spread of the disease, but its economy is doing worse. And also, it seems that European policymakers have been sitting on their laurels all summer, while the total cases accumulated since the March are still about 1/2 in Europe on a per capita basis compared to the US. The latest numbers are actually higher for Europe than for the US. So if 70,000 is a lot for the US, we have more than that in Europe. So we really need to watch out here. Mm. Now we have, at least we pride ourselves to have less factional fighting, more consensus approach to policy making. And still, even if I take the average and average out Germany versus Italy or Spain and France, I must say I don't see much benefit from this more consensus-oriented policy making. And maybe we can discuss this later. I see a danger that this consensus-oriented policy making will actually lead to some freezing of the economy in place under the motto that nobody is allowed to suffer anything and nobody can be forced to change his or her job. And I'm very much afraid that in a year from today, we will wake up with perhaps an end to the epidemic, maybe slightly lower total costs, but an economy which we have to take out of the freezer and see whether it can survive in this new world.
Okay. Well, I will toss that back over to you, Barry. I mean, I would like to understand that better. How is it then that Europe has been doing better in terms of numbers, or to both of you, but the economy is doing worse, whereas the US, the way I understand it, the economy is doing okay, even though the numbers are, well, have been so much bigger, but now Europe is going up as well. How do we explain that?
So I should start by saying any generalization about the coronavirus and how it's been dealt with in different countries needs to be continuously updated. Things are changing, as we know, before our eyes. My reading of the situation in the United States is that with the spike in cases that the country is currently experiencing, the economy will weaken in response to that. Consumers will again grow more cautious about going out to eat in restaurants, and airline traffic will not recover, etc. The stock market seems to agree with me. At least it did yesterday. It agrees with me every second day in that it did weaken in response to the spike of cases. I very much share Daniel's concern about freezing the economy in place, and the different approaches in the two countries, in the two economies, were very evident at the beginning. I think the question now is whether Europe can pivot in the direction of protecting the worker rather than protecting the job. I was listening to the previous session, and I was struck by the extent to which the need to change the structure of the economy in the direction of digital and green was combined with keeping the existing firms alive and in place, and allowing them to pivot in the direction of digital and green, rather than what will probably be done in the United States. We're better at the destruction part of creative destruction than you are. And some of those firms in transportation and hospitality and brick and mortar retail will be allowed to go under here as part of that restructuring process. Will that occur in Europe, and to what extent?
Can I just add one comment on the impact of the spread of the disease itself directly on the economy? I did a little piece here where I looked at different European countries and some monthly data to see what has the strongest impact on the economy. The actual number of cases or the official restrictions imposed by governments, which are measured by this famous Oxford indicator of restrictiveness. And what we found was that this restrictiveness indicator has a very strong correlation with the growth rate of GDP or industrial production. But the cases don't seem to be influential. Of course, the objection is that when cases go through the roof, then you might have to put in restrictions in place. What I wanted to say is that a society which, dare say, a la Donald Trump says, we just live with the virus, we don't impose restrictions, might not suffer much from the cases themselves. I mean, the airline industry and the restaurants might be sectors which suffer, but they are really marginal sectors in terms of the overall economy. So maybe we have in Europe this problem that we are so risk averse that we put in too many restrictions in place, which not only keeps the workers in enterprises which have no future, but also which depresses a certain sector over and above what would be natural by the individual reaction of people.
Two comments about that. One, that is one interpretation of California experience, that we clamp down very hard in this state and have done better than most at containing the virus, despite the fact that we have farm workers and others who are in a very exposed position, and our economy has suffered as a result. A second comment would be, send me that study, please. What I haven't worked in this area, but what I've seen for the US based on Google mobility data is that economic activity measured in that way responds to the cases and not to the non-pharmaceutical interventions.
We use the Google indicator as well. We can discuss that later.
Mm-hmm. So as it does look like in many places we are going into a second wave right now. I mean, one could argue if the US is still in the middle of the first wave or a third wave or what state it's in right now, but it does look like the Europe is heading into or is fully into a second wave. Are there lessons that we can or should have learned from the first wave that we should be then using right now?
If I may come in first, the approach which most economists and I think also epidemiologists proposed was you clamp down hard and then you track and trace so that you keep it at a level at which you can track and trace. And Europe thought it had reached that level, and then nothing was done over the summer. Testing was not increased because one should have known that when the bad weather comes, the famous R number, the spread of the disease accelerates, ceteris paribus, and therefore one needed to be even more vigilant, even more testing and so on. And that was not done, and that's why now the cases are again going out of control. So this leaves us with two solutions. Either we say we clamp down once more to the level where we can do track and trace and this time do it properly, or we just, as they say, just prevent the worst and have some circuit breakers from time to time, and then hope that come next spring with better weather and better vaccines, we can exit the most stringent measures. So that is, I think, the lesson I would draw from the opportunity missed earlier this year.
I would agree with that. I would add the importance of testing, which we really see in the United States in the contrast between certain colleges and universities that have been able to operate safely using testing all their students multiple times a week, and other colleges and communities which have not tested and which have not had a good experience. Mask wearing is important, and I find it quite striking that masking has become such a political issue in the United States. It's like you should remember to wear your pants when you go outside. You should remember to wear a mask in this day and age, and yet we can't have a sensible conversation about that in the United States. It's another indicator, I think, of the importance of leadership as a positive or a negative force. I'm not referring to one man, but more generally to politicians who have not acquitted themselves well in this context. Economists, for once, may have acquitted themselves a tiny bit better.
In this note, I'm going to refer to a question that just came in from a viewer, and it is for you, Barry. Regarding New Zealand, they ask, could it be that trust in government substitutes for communalism in the positive outcome?
I do find in that earlier research that I cited that how effectively government responds to an outbreak can shape trust in government very profoundly. So I don't have the impression that New Zealanders were necessarily more trusting in their government prior to this crisis, but I think they've seen the competence of the government response. So where in the US, we're in a vicious spiral where people don't trust in government, and that allows the epidemic to spread, and people then trust their government even less than they did before. In New Zealand, I think they're in a virtuous spiral, at least for the moment.
Can I ask you, Barry, when we talk about government, right? You say singular, but in the US, it's really the states, the individual states who have most of the power to take the decisions which practically affect the disease. And New Zealand, as far as I know, is a pretty homogeneous state and also much smaller, right? About the size of one individual US state. Now, even with the best of intentions in Washington, in a country where health policy is so dispersed and where you have free movement of people, is it actually possible to really stop the disease from spreading?
I do think it's possible. I would acknowledge that it's more complicated in a federal system where a lot of power and responsibility devolves to the states. We have had some competent state governments, but we very much have a coordination problem because of mobility, because of the competitive struggle for PPE and for a variety of reasons. In a way, the problem we have in the United States is very much a legacy of history. The country was set up, the Constitution was written to give powers to the state and only allow the federal government to exercise a specific range of powers. I do think had the federal government done that more effectively, using the Defense Procurement Act more extensively, used executive powers which the president possesses to ensure more uniformity of non-pharmaceutical interventions. I don't mean they have to be the same everywhere, but there ought to be more coherent guidelines about what kind of interventions are appropriate in different places. It would have been possible to meet this emergency more effectively. And finally, New Zealand has another advantage you didn't mention. It's an island.
That was a question in Europe earlier this year, whether you can make your individual country an island. And borders were closed. But for me, somewhat surprisingly, the generalized conclusion has been by policymakers that didn't help much. And I think one of the problems in the countries which have a lower spread, like Germany, like the Northern Europeans, come from travel. If you see the red regions in Germany, they're all at the borders. And of course, if you don't have enough testing capacity at the border, then I think you have a similar problem like the United States. Mm. But I think the borders could have been used much better in Europe.
I've just received another question from a viewer. Can devolution make for much better decision-making, as we have seen in Germany in relation to healthcare during the crisis?
That is to whom?
That's an open question. Who would like to take that one?
I wouldn't take, I mean, the German federal system worked okay during the first phase of the crisis because it lends itself, after much huffing and puffing, to actually some joint decision making. But I think more recently, it is not working so well. Because the emergency feeling is no longer there. You don't have the same degree of political, whatever, left versus right or other differences. But still, given that different lenders are always affected somewhat differently, have different interests, my view, the federalism doesn't work very well. And more importantly, it doesn't allow you, what hasn't allowed you to come to a situation where you say, we agree, we go to close to zero. That means we are maintaining strict controls, even if currently rates are very low, right? And that is very difficult to maintain until you can really switch to tracking and tracing. Mm-hmm. And I think that is one of the big weaknesses of the German system right now.
Mm-hmm. Okay, I would like to make a slight switch, going from, we were in New Zealand, we were in America, we were just in Germany, and a question has come in with regards to China, and that was the topic that we also wanted to discuss. The strong recovery of China's economy, signaled in the data of the third quarter of the Chinese gross domestic product, shows that putting the new coronavirus under control and keeping it like this is the best for economic growth. So what is it? Why has China recovered so successfully?
I think, as you said, it has done a pretty good job at containing the spread of the virus, not quite as successfully as some other Asian countries, but almost. And the Chinese case, like the US case, is handicapped by the fact that it is such a large and diverse country. You can clamp down on the virus in one place and it can pop up in another. China has, in addition, applied a significant dose of fiscal stimulus, not as large as in the United States and certain other countries, but its recovery was driven up to now by investment rather than consumption, by lending to state-owned enterprises and others. So in a way, has been the same tension in China that you may experience in Europe, that they have been trying to pivot away to rebalance the economy away from investment toward consumption, away from SOEs toward private enterprises, away from heavy industry toward high tech. And the way they have fueled their recovery is kind of a step back from that rebalancing. Now there's signs of consumption beginning to pick up, but up until now, they've done it by shelving for the moment their desire to rebalance the economy.
Good. Daniel, did you have anything you want to add on that?
I mean, it's very clear. This is a bit what Barry said at the very beginning. Mm-hmm. If you do very well, but not temporarily very well, but once and for all in combating the crisis, the pandemic, then your economy goes better. And that was a combination of being strict, but strict not just until you have a low level of cases, until you're close to zero. And then you remember the two famous episodes when they had a few cases in Beijing, later and earlier in Wuhan, and they tested the entire cities in 2 weeks, right? Which is logistically enormous exercise. You have to have the capacity, right? In Europe, nobody has built up the capacity to do that. And also, if you think about it, you always have false positives. So you will have to test many people twice or 3 times. But if you do that, you can really get to the bottom of it, of course, if you can keep your borders closed. That, of course, in the case of China, is much more easy to do than in case of Europe. But the key in getting it really to zero was massive testing. I mean, you test 10 million people to get 100 positives. Right? Here in Europe, the doctors would say, that's totally ridiculous, a waste of resources. Who should do that, right? Mm-hmm. But the payoff, the longer-term payoff from this approach has been very, very large indeed.
Mm-hmm. Mm-hmm. A broader question, is China expanding its role as an engine of global growth in this time when given the situation, given the way the rest of the world is handling the pandemic and seeing that it's on the up and up?
I think China is expanding its role more broadly. It matters more for global growth insofar as it's growing by 4 or 5%, and the rest of us are not. More broadly, I think it is more assertive geopolitically in the military domain, in the diplomatic domain. I don't think there's any question about it. Whether it will make progress in the monetary and financial domain as well, we will see.
Mm-hmm. Mm-hmm. I think a locomotive or an engine of growth, that applies, of course, only to economies which export to China. And here is a big difference between the US and Europe. European exports, especially manufacturing exports to China, are much, much larger. And they weigh much more in the European, especially in the Eurozone economy. So it could very well be that, like after 2008-9, that Chinese growth will be the factor which allows Europe to come out of this recession. Because just Europe produces many of the things which the Chinese maybe still, and doesn't know for how long, still like to buy. And Europe depends much more on exports than the United States.
I would only add the obvious point that some European countries are more China-oriented, more export to China dependent than others.
Yeah, you're alluding to Germany, I presume. But actually, as you know, many goods made in Germany are actually composed of inputs from many other countries. And from what I've read, especially northern Italy, for example, now is very much interwoven with the German industry. And therefore, maybe it goes first to Germany, but it has an effect, a trickle-down effect, if I may say so, on others. Of course, what others are missing, like Italy and Spain, and France, are the Chinese tourists. And I don't think they will come back for quite some time, given what they can read and see about our epidemiological situation.
I'm hoping for the Chinese students.
Chinese international travel is still at, I think, less than 1% of the previous level.
Wow.
That's how they can keep it under control.
Mm.
And I think no Chinese tourist has the inclination to go for short trips to Paris when he or she comes back and has to spend 2 weeks at least in a government hospital, not hospital, in government hostel to qualify for readmittance to the country.
Mm. Yeah. That's pretty strict. I know when I flew into the US, no one took my name, my number. I walked right in with no problem whatsoever, no quarantine whatsoever, nothing. So,
did you have a test?
I had a test going back to Germany. I had 2 tests actually, because that was required by German law. But arriving in the US, I did not have a test.
Okay.
I wore my mask everywhere. I wore my mask 18 hours long on the flight over. But no, I was quite surprised with how relaxed it was until I flew to New York when I had to give them all of my information. They were looking for that. But I'm going to go quickly to another question that we have received from a viewer. It's for you, Daniel. Do EU governments have enough capacity and knowledge to deal with a crisis such as this one? Namely, years and years of cost-cutting in the public sector have deprived them from necessary knowledge and knowledgeable people and resources to deal with crises.
There is some truth into this assertion that years and years of cost-cutting have depleted the medical responses in some areas. But actually, I looked at it at the height of the crisis, and what you saw was that the biggest cutbacks in medical expense were actually not in the crisis countries, but in some Northern European countries, where they thought they had excess capacity. For the Germans, perhaps it's interesting to know that last year, a big German foundation made a study about the number of intensive care units in German hospitals and thought that these were 4 or 5, I don't know, a large number more than what was needed, and recommended to cut them. So there was a lot of waste, which now, okay, by chance came in handy. But in the end, it was not the number of hospital beds which was decisive for keeping the virus under control. You need the intensive care units when you fail upstream, so to speak. And here, I think the Germans, or let's say the Northern Europeans, were lucky. Many German epidemiologists say actually there's nothing that was really done better in Germany. It is just that we had the luck that we could see what was happening in Italy. And basically very similar measures were taken in Germany, but compared to the development of the disease 2 or 3 weeks earlier. And that allowed the system to keep the outbreak under control. Mm-hmm. Mm-hmm. And therefore I would say, yes, there's been some cost cutting, and I think Italy and Spain are the countries which are mentioned, which were then, of course, not helpful when you had to deal with this acute disease. But actually, one must say that mistakes, understandable mistakes, were made at the beginning when too many people were put into these intensive care units because people didn't know better. The doctors, they were the first time confronted with this. And now we see actually that this is not really the key issue. The key issue, how you keep the spread of the disease under control, and that requires a system approach. system from the bottom up with tracking and tracing. This is, I think, what has been failing in some countries, partially because they were the early ones to be hit and nobody much knew what to do about it.
I agree with Daniel's point, but I would add the observation that we're still this week setting up temporary intensive care units in tents outside hospitals in Iowa and Texas and elsewhere. We still have a capacity problem owing to those upstream failures, which speak to a broader point that we'd gone too far in the direction of lean production. We'd gone too far in the direction of not building robust systems and having a modicum of excess capacity. That was true in healthcare, and it of course is true more broadly that firms in a variety of sectors are rethinking that they need just-in-case production methods in addition to just-in-time. True for healthcare, true elsewhere also.
Can I expand that point? I think it's a very important one, what you just said, that basically keeping only the bare minimum, right, for production. And I would like to apply that concept also to fiscal policy. In a sense, a low debt level is some spare capacity to go into debt, right? To spend when you need. And this was, in my view, the advantage of the famous Black Zero in Germany, and similar policies de facto followed in Northern Europe, in other parts of Northern Europe, because then it allowed you to spend freely when it comes, when the emergency comes. Isn't that something we should keep in mind when we say now, oh, because of low interest rates, any debt level is basically bearable and countries should just spend without looking at the debt they're incurring?
Certainly it would be better to have lower debts rather than higher debts. Certainly it would be better to get into the habit of running budget surpluses in good times so we can run larger deficits when a bad thing happens. To my mind, the complication is that we don't know when the good times will return. If we're headed into an extended period when consumption will be weak because households have been reminded that they didn't have enough precautionary savings entering the crisis. And investment will remain weak because firms are uncertain about the post-COVID lay of the land. They don't know what the economy will look like and whether to invest in inner city real estate or suburban real estate or whatever. Then we may have an extended period when we need more public spending to substitute for less private spending. So I'm on board with Daniel's principle. I just don't know when to implement it. I know this sounds like St. Augustine, right? Save me, O Lord, just not yet. But there's an element of that.
I mean, that's the problem. This is not time consistent. And we have seen it too often, especially in Europe as well. And I'm getting worried that some countries are just getting used to just say we can spend without limit. And now we have had in 10 years, 2 once in a generation shocks. We should be more careful. If the next one comes around, and if you start with a debt ratio of whatever, excess of 150, 160% of GDP, then the cupboard is bare. Shouldn't you figure that in even today? Even I acknowledge the desirability to supporting the economy, but I think there's also this view that you should be extra careful on the level of the debt.
Shouldn't we also worry about the danger that if you withdraw fiscal stimulus prematurely, you don't end up lowering the debt to GDP ratio because you crunch the denominator?
Well, I mean, thanks for giving me the occasion to repeat an argument which was already made 2011. You might have a short-run multiplier impact, right? Could be 1, even 2, right? But all our models tell us that if you keep a deficit up, you don't get continuously higher growth, you get a higher level of GDP. But after year 1, when the GDP settles down to its lower level and you have a flow addition to the debt level from the deficit, the debt GDP ratio sooner or later will start rising. So this self-validating fiscal expansion is possible only in the very short run, not in the medium run. And if you do it 1 year up and 1 year down, then little gained.
I do agree with the general point that fiscal planning is an important aspect of planning for the post-crisis environment. I'm just uncertain about when we get to the post-crisis environment.
Okay, and then I think, if I can insist, this is the second point which I find very important. Usually the argument is that during a recession, fiscal policy has a very large multiplier, because you have many people who are cash constrained. They're expecting to have a higher future income, maybe because of financial restrictions. They cannot already today act on that future higher income and spend today. And if you give them the money, so to speak, even if they know they have higher future taxes, they will spend more today. Whereas, so that means you have a fiscal expansion today in a recession, and tomorrow when the good time comes in a deal planning, you would have the fiscal restrictions, so to speak. You could go back on fiscal spending. And that would work out. And since on the upside, the expenditure was done during time when it does a lot of good, and reducing expenditure is done when time when it doesn't have a lot of large bad impact on the negative impact on the economy, you gain. Are we not in a different situation right now? Because in the current situation, we have some particular sectors which are weak and will remain weak, like, as you know, airlines, restaurants, and others. So we will never, we will, as long as the virus is around, we will not close the output gap. And you know the papers by Mackay and Fari. That would imply that today fiscal policy is less effective than usual, which would suggest that you keep your powder dry until tomorrow, when fiscal policy will again become more effective, meaning tomorrow when the virus is no longer around, and if there's still a hesitancy of consumers to buy stuff, then you should use your fiscal policy. Wouldn't that be an argument to say, today you limit yourself to providing some replacement income, and tomorrow only you roll out the big fiscal bazooka?
Yeah, I think that makes sense, that fiscal policy works less powerfully than otherwise, because people are not going to go out to restaurants whether you give them a $400 check or not. I think there is still a case for fiscal policy to put food on the table where that's necessary, as in the United States, to give schools the resources they need in order to open safely and stay open safely. But I think what you described, Daniel, is a sound argument for not overdoing it.
And that is, sorry if I can continue, this is what I don't understand. If you have an output gap of, let's say, 4 or 5% of GDP, in principle, you will need 4 or 5% of GDP to provide people with replacement income. But at the same time, if you have a deficit of, I don't know, for the US, pick a number, 10, I don't know, 11, 12% of GDP, it seems that there's a lot of excess in there. And the similar, I could say, for many European countries. And that's what having me worried, that countries go much beyond providing replacement income, running up debt, which they might not be able to run up again tomorrow. And shouldn't they keep that powder dry for when it really becomes much more effective?
So in the United States, as you well know, at the moment, we're having a debate about another stimulus. Should it be 500 billion? Should it be $1 trillion? Should it be 2 trillion? Should it be 2.5 trillion? I think the right way of answering that question, as you imply, is to build up from the bottom to decide what should be supported, that we need to support essential workers at the state level who provide the firefighting services and the police services and the health services, which states cannot afford to keep on payroll because their revenues are cratering and they can't borrow by statute or state constitutional provision. Add up those items and see what kind of stimulus you end up with rather than starting with a headline figure. I think there is that process of adding up from below going on in the United States behind all the political rhetoric and infighting, but the reporting about the stimulus is all about the headline number instead.
Speaking of the US, Barry, I would be remiss if I didn't ask, because I know that as an American here in Germany, I'm constantly asked about the election coming up and constantly asked to give a prognosis, which I personally, I think there are so many factors. I think this year is such an exception in so many different ways. I mean, I can't even count them all. And therefore, it's really hard, even hearing the polls, as we know in 2016. I think a lot of people felt quite confident with a Hillary Clinton win, which didn't materialize because of polls. And they seem to be quite positive in Biden's favor again this year. When you're asked, or if you had to say something to people maybe on this side of the pond who are asking what's going to happen, if you had to provide a prognosis, what would you say to them?
I would say I'm not the best person to ask because I live in California. The University of California, Berkeley's Institute of Governmental Studies published a new poll of likely California voters yesterday. And if I recall it correctly, it was 76% Biden. So I do not encounter a lot of Trump supporters given where I live. I think an interesting issue to think about is how this spike in coronavirus cases will affect voters, older voters, et cetera. My view is not very much because a lot of people have voted already on the basis of older data. It's clear that the race is tightening, has been tightening in the last week or so. So I think the implication of that and the implication of 2016 is we can't take anything for granted. The unprecedented, except for 2000 part, is that the election may not be decided on the first Tuesday in November, and we may have a very interesting and disturbing process of litigating the outcome thereafter.
I think, yes, it could make these hanging chads of 2000 look like child's play compared to what we may have ahead of us. I am going to, we're close to wrapping it up. I would like to give you each a few minutes to make a closing statement, make any point that you wanted to add in order to wrap up our session, anything we may have left out that you would like to address.
Who goes first?
Daniel, why don't you go first?
Okay. I'm concerned about Europe, and not for the next 3 or 4 months or 6 months. It will probably be a pretty hard winter. But I'm concerned Europe going through this and finding its economy, as we said earlier, unchanged, unprepared for the new environment, and governments continuing to protect not the worker, but the jobs. You see in Italy a total blocking of any new firings. You see in many other countries also these short-term working schemes being extended to 2 years, and they tend to keep the workers at their place. And the losers are forming larger and larger coalitions, and their manifesto is usually this is a crisis which we didn't deserve, we need to be protected. And protection means no creative destruction. So that's why I'm really concerned that Europe, despite all this talk about digital Europe and the recovery fund, will de facto fall even further behind, whereas in the US, the adjustment, in my view at least, has been brutal but effective. And that is what makes me concerned medium to long term about Europe.
I agree with that diagnosis of the comparative economic prospects of the European and US economies. We are the champions of creative destruction. The piece I wrote on this for Prospect magazine was called Schumpeter's virus. And I think that will be an issue for Europe going forward. But for the United States, I'm much more worried about political division and social division, and whether we can get, whether we can pull together as a country, and if we can't, what that will imply for policy, et cetera. I worry about the disjuncture between the political orientation of the Supreme Court and the political orientation of the majority of the country, and what that will imply for checks and balances and effective governance. So I think we will have a case study of the relative importance of economics and social cohesion.
Okay, and I think with that, or Daniel, did you want to get one last word in?
I just want to say the Europeans will be poor, but everybody will be poor. The Americans will fight among each other, but at least many of them will be rich.
Some of them.
A small number. Okay, thank you both very much for joining us today. Thank everyone who tuned in. This will be available, this talk, on the YouTube channel of the CEPS think tank. And we will have our Intereconomics conference issue coming out at the end of November, which will be up online and available in print. Feel free to ask us any additional questions on Twitter or visit our website as well. Thank you both for being here. Thank you to CEPS and to Veselina and to Cinzia, and for all of the assistants and all of the colleagues here at Intereconomics. And have a lovely evening.
You too.
Thank you.
Have a nice day.